तो आज हमारी 20th CII की एनुअल हेल्थ समिट है और इस साल हम ये चर्चा कर रहे हैं कि कहाँ पे हम हैं हेल्थ केयर सिस्टम में, नॉट ओनली डिलीवरी सिस्टम में, पर कैसे कलेक्टिवली हमें हिंदुस्तान की जनता जो है, जो लास्ट मैन स्टैंडिंग जिसको हम कहते हैं ऑन द अर्थ ऑफ इंडिया, हाउ टू गेट देम क्वालिटी हेल्थ केयर in the coming years. So at the end of 2023, we are now discussing what progress we have made, and today we are going to release the new health report done by CII and McKinsey to map out what should be the future course that we should take to be able to deliver the best care to all our citizens in India. So keeping that in mind, this report will be released this afternoon by our Minister MOS from Health, Mr. Baghel, and we will then set the roadmap for how we have to make everything that is required to deliver healthcare at the highest level, at the most affordable cost to all our people is the aim that we have, and we from CII and all its participants are aiming to come together to achieve that goal for India in the very near future.
So 2023 has been an excellent year for the industry, where we have seen new regulations being enacted for medtech industry. Now today, as on today, all medical devices in the country are regulated, which is a big change from what it was, let's say, pre-COVID. It's taken 3 years, but I think from 1st October 2023, we see that a lot of transformation in the industry. Today, more than 2,000 new companies have started manufacturing in the country, which started from the COVID time, and at the end of 2023, we have reached to that stage. A big change in policy making, where new R&D policy has come for medical devices, which was recently announced. PLI is further getting enhanced, and more companies are going to come under PLI policy. So 2023 has been a transformative year for the medtech industry. Going forward, 2024, we are expecting the new Drugs, Cosmetic and Medical Device Act to come in. It's going to be placed in the parliament soon. So 2024 will be a defining year. An act which was made in 1940 is going to be changed. Medical device industry is going to be recognized as a separate industry, a separate chapter under the act, which is a big transformative step by the government of India. We are also going to see more medical device parks coming in the country. 2024, where some parks will get operational. These parks were announced in 2022, 2023, and now we are going through that whole change where new parks are getting transformed and will be specific to industry specific needs. So big changes expected in 2024. We will also see a big policy shift where government is focusing more on Make in India in medtech sector, because we are still 70% import dependent. So we are seeing that government will push more for manufacturing, and we may see some more support to local domestic companies for Make in India.
The year 2023 was one of hope and optimism as we came out of COVID, and as a representative of the healthcare delivery sector, it was a year of rebound, so to speak, where we were able to get back to our core business of providing succor to the patients. I think in 2024, we look forward to the trends continuing and increasing our ability to cater to particularly the underserved parts of India, the tier 3, tier 4 locations, and that would need to be a key priority.
Yeah, as we bid goodbye to 23, now we are putting together plans for 2024 at Dr. Lal Path Labs. And our basically 3-4 objectives that we have set out for ourselves is one, to widen and deepen our footprint, open more and more collection network across the country, and reach out to as many patients as possible. Second is keep launching newer tests and keep widening the test menu, especially in the area of genetics and genomics. That's the second part that we continue to do. And then I think third most important is to run the organization very efficiently so that we can further enhance affordability to our patients. So these are the broad plans for Dr. Lal Path Labs. Thank you.
Hello and warm greetings. My name is Dr. Shuchin Bajaj and I am the founder director of Ujala Cygnus Group of Hospitals. As we are bidding goodbye to 2023 and getting ready to welcome the new year, our plans are really exciting. We are looking to open more hospitals and serve more communities. We've had a wonderful 2023 with new hospitals in the state of Jammu and Kashmir as well as Uttar Pradesh, and we're looking forward to serving more states, more communities and reaching 25 hospitals by the end of 2024.
So after 2 years of the COVID pandemic, things have now come back to normalcy. Hospitals have started doing their own non-COVID work, the high-end surgeries, footfalls into hospitals have increased. And what this pandemic has done is that it has created more awareness about healthcare. Patients today want to get their health checkups done, they want to get their insurance amounts enhanced, because gone are the days when they used to think that this won't happen to me. The pandemic has been a wake up call because people have realized that at some point they may need hospitalization. So as 2023 draws to a close, we see more and more patients getting worried about their health, coming for their health checkups. Overall, I think it's going to be a good time for healthcare. People have started taking charge of their health, and in the years to come, we expect people to be more concerned about their health. We are also seeing a lot of adoption of technology. We are using technology to access more patients, both in the rural as well as in the urban areas. This saves patients from coming into hospitals. So overall, I think it's going to be an exciting period for healthcare in the coming years to come. And Indian healthcare, I'm sure, is going to be comparable with the best in the world.
Namaste, my name is Rajiv Vasudevan from Apollo Ayurved Hospitals. As I look back on 2023, I see a period of unprecedented growth, right? We had substantial growth in flow of patients and the kind of care that we could provide through authentic Ayurveda, protocols-based Ayurveda medical care and integrative care, where we work in our tertiary care hospital partners like Medanta, Aster CMI, Apollo and Sri Shankara Cancer Hospital. So that has been the past. When we look at 2024, we see only the pace accelerating because Indians are increasingly looking towards Ayurveda and yoga, towards both preventive care, also curative care. And Ayurveda has got a huge role to play across the life cycle of every patient from cradle to grave. And I see 2024 further strengthening this whole process of consumer acceptance of Ayurveda as a mainstream system of medicine, and look forward with optimism to not only 2024 but beyond. Thank you very much.